I'm Nicole, and I will be doing a demonstrative speech on how to do a lung assessment. Alright, here we go. Okay, you are an ER nurse working, and the patient comes staggering into your room complaining of chest pain, a cough with phlegm that neither worsens nor improves, and gets shortness of breath every time they do normal daily activities. You take her temperature, and she has a temperature of 102. What do? As a nurse, initially you would do a lung assessment. So today I will teach you parts of the stethoscope, how to do a lung assessment, and some abnormal lung sounds that you can listen to. So let's start off with parts of the stethoscope. First off are the earpieces. Most people just like to put them directly into your ears, but that's often really uncomfortable for the nurse and kind of decreases the sound of the lung sounds. So what you can do is just kind of turn them inward, and that makes it much more comfortable and really enhances sounds. Next is the tube. A lot of stethoscopes are either single tube or double tube, whichever one you prefer. You want to make sure that there's no kinks in them, that when you're listening you don't want them to rub on your cloth and stuff, because that can make a sound familiar to a lung sound and can confuse the nurse and make a wrong diagnosis. And then lastly is you want to use the diaphragm side of the stethoscope because it really enhances sound more than the bell side. And then with the stethoscope, you want to make sure that it touches directly on the skin, because if you listen over a t-shirt, it can make a sound as well that sounds familiar to a lung sound and again confuse the nurse. And then also you want to hold the stethoscope between your two fingers like this. And then sometimes if you're listening you can't hear anything. It could be because your stethoscope is locked. So to unlock, you just want to turn the stethoscope clockwise, and to test it you just put the earpieces and just lightly tap the diaphragm. If you hear a sound, you know it's unlocked and you're ready to go. So now that you know parts of the stethoscope, let's move to actually how to do the lung assessment. So we're going to do the anterior side first, which is the front side. And there are 6 spots on the front, and you always want to start at the base of the lungs, which is the bottom, like towards the rib cage, and work your way up. Then also it's really important to compare left to right or right to left, depending on which side you start on, because just because you hear it on one side doesn't mean you hear it on the other side. You just want to compare the symmetry of it. So then you just want to start towards like the end of the rib cage, like I said, and listen for a few seconds. Then you want to move directly over to the left, comparing again. Listen, and then you want to move up just a little bit below the breastbone. And then women who have bigger breasts, you might have to lift up the breast and listen to get a better sound. Then again, move over to the right side and compare. And the next position is up here, right below the clavicle bone. Listen again for a few seconds, and then compare to the left side. And that is the anterior lung sound. And the next one is the posterior, or the back. The route that uses that stethoscope is very similar to the front, but there's just some minor changes that we have to do. But there are 6 spots like the front. And again, you want to start at the base and compare the right to the left. And then you want to start over here and then move over. But this is where it kind of changes a little bit. You kind of want to narrow in, because if you go straight up like up on the front, you'll be listening over the shoulder blades. And if you do that, you won't be able to hear anything at all. So you kind of want to be more medial to the spinal cord. And then you want to compare the left to the right in the same position. Then again, just go straight up from there, listen, and then straight across, comparing the left to the right. And that is how you do the lung assessment. And now that you know how to do the lung assessment, let's talk about some abnormal lung sounds you can hear. One of them is crackles, and that one is the most prevalent in pneumonia, because the water fluid gets in the lungs. And that sounds like a low pitch that starts early in inspiration and may even extend to the expiration. And way to describe the sound of it, it kind of sounds like Rice Krispies crackling. That's the best way to describe it. Another one is wheezes, and that is a loud, low-pitched, heard primarily during expiration, and the cause is narrowing of the large airways. And kids with asthma or have bad allergies often have wheezing because they're just trying to push the air through the airways, but it's too narrow, so it's causing the wheezing sounds. And then next, another one is stridor, and that is a high-pitched, piercing sound that occurs secondary to upper respiratory obstructions such as croup, which is the barking cough that you hear. or it can be caused from a foreign body obstruction. And of course, there are a lot of different types of lung sounds, but those are just some, to name a few. And now that you have become an expert at lung sounds, you could actually use these material in a real life situation and use it on a real patient someday. Thank you.